Hey, how you doing? This is Dr. Kilcup, and I'm about to give you a lesson in appendicitis. The reason I'm doing this video is because about 3 weeks ago, my son Benjamin had his appendix removed, and in the through the experience sharing it with friends and family members, people had lots of questions about it. So I thought, you know what? When I get done with all of this stuff and I get my life back in order, I'm going to make a video so everyone can find out what appendicitis looks like. How do you know when to take your loved one to the hospital? So that's what this video is going to be about. I'm going to educate you about everything about the appendix, what it is and how it goes wrong. You're going to learn when to take someone to the hospital, and you're going to learn from our experience. I'm going to share that with you, no charge, just because I love you. Alright, so where in the world is the appendix? Just for kicks, if you laid one of your kids down and drew a horizontal line right through the belly button and a vertical line right through the belly button, in the lower right quadrant you would be in the neighborhood of the appendix. And to give you a little more clarity on that, here's a photo. My ring finger is on a pointy bone that if you press on the side, you can feel it right there. It's called the anterior superior iliac spine. And then my pointing finger there is right on the belly button, and right in between is about where you're going to find the appendix. In most people, that's where it's at. But not everybody, because some people just like to be weird and they put their belly button. They put their appendix in other places down there. But for the vast majority of people, that's where the appendix lives. So what is the appendix and what does it do? The appendix is about as big as one of your fingers. And it's a pouch, kind of like a cul-de-sac. And it's right at the junction where your small intestine meets the large intestine. That's where it's at. And it contracts. Your contractions, called peristalsis, happens in the small intestine. And the reason it contracts is because it makes white blood cells. And these white blood cells get kind of squirted out as they're made. And that's one thing it does. A lot of people who arrogantly say the appendix does nothing and it's just a leftover thing from evolution. You know what? These people are so arrogant to think that they know everything there is to know already. In my research for this video, I found out that now researchers are finding that people who have been exposed to certain types of radiation, their appendix is really important in fighting those infections. And I'll bet you anything, as time goes on, we're going to find out the appendix does even more. So that's what it is, and that's what it does. So how in the world do you get appendicitis? Well, it's very simple. The appendix becomes obstructed. And I know what you're thinking. What can obstruct my appendix? Well, it's kind of gross, but you can form stones, kind of like poop stones in there, and they block off the opening to the appendix. Or these lymph nodes that are in your lower abdomen can swell, and they can pinch off the appendix. Parasites can obstruct it. So anything that obstructs the appendix is what causes the appendicitis to start. I'd like you to imagine if you put a rubber band around your finger and put it on real tight so you cut off the blood supply to it. That's what happens with appendicitis. The obstructed opening pinches off the blood vessels that are feeding the appendix, and the appendix begins to swell just like your finger would. It becomes painful just like your finger would if you put a rubber band on it. And over time, the bacteria that's in the appendix begins to grow out of control because the appendix is now dead. It doesn't have any blood supply. It's not making white blood cells anymore. And that infection grows and grows. And appendicitis is a very serious condition because that appendix can rupture, the contents can spill into your abdominal cavity, and you can become septic, which simply means your body's overrun with bad guys and you can die from that infection. So it's a very serious condition. It needs to be taken seriously, and that's why I'm doing this video. Alright, so what is it? I kind of explained that already. The difference is, instead of the appendix just being happy little white blood cell making piece of tissue down there, it's now inflamed and it's dying and it's getting infected. Alright, so what are the common symptoms? Now, when I say symptom, I mean things that the patient will say that they're suffering with. One is they're going to have a tummy ache. Now, it might be anywhere in the abdomen in the beginning. It might be around the belly button, kind of diffuse all over, but they're going to have a tummy ache. And they're not going to be hungry. They might be vomiting. They might have diarrhea. They might have constipation. Now, they're going to have pain that begins to localize to the right lower abdomen. And we'll talk about that more in a second. And if you watch them walk, they're going to walk bent forward and leaning to the right. And that's a real important thing to look for. Now, let me tell you, people with appendicitis rarely have all of these symptoms at the same time. They might have some of them for a little while and have others later. That's kind of how Ben was. He had most of these symptoms, but at different times as the disease progressed. So we took a picture of Ben here today, and I'll tell you that is exactly what he looked like when we were walking into the emergency room. He's bent forward to the right. He's holding his appendix area because it was very inflamed and very tender. And when you see that kind of a posture, that's a concerning sign. All right, so what are the signs? Signs are things that you test for. You test for signs. So they often have a fever with appendicitis. They have tenderness. Now, tenderness as opposed to pain is when you press on it, it hurts. So the patient might complain of pain, and then you press on it, and sometimes it doesn't hurt in the area. Well, with appendicitis, if you press over the right lower abdomen, it's going to hurt. The pain can be a lot or it can be minor, but it's going to be more tender there. Now, here's a big clue. When you press on the left lower abdomen, it hurts on the right lower abdomen. Ben had that. And they have rebound tenderness over the right lower abdomen. And you say, what is rebound tenderness? Well, have I got good news for you. I made a video of rebound tenderness. So here we go. You press in over the right lower abdomen, and then you let go really quick, and the patient goes, ouch, that hurt. And you go, what hurt? I mean, when I do this, when I press down, and I let go real quick, that's when it hurts? And they go, yes, don't do it anymore. And you say, oh, but it's fun. I want to do it one more time. And this is rebound tenderness. And that's another sign that you might be having someone with appendicitis. All right? All right, so here's the big question. When do you take someone to the hospital? When is it time to pull the trigger and say, that's it, pack your bags, or go to the hospital? All right, so before I give you the answer to this question, I want to stress that appendicitis is a little sneaky. It doesn't always follow the rules, and not every patient is going to have this answer, but a vast majority will. So obviously, I'm not telling you to only take your loved one to the hospital if they have this particular symptom. But I'm saying if they have this symptom, you need to take it very seriously. All right? Ta-da! when their tummy ache goes from their belly button to the right lower quadrant and kind of localizes there, that is a big red flag. Bells and whistles. Hey, I might have appendicitis. You need to take me and get it CAT scanned so we can see. That's what that sign's telling you. Now, Ben had that. Ben had tenderness over the right. He had tenderness on the right when I pressed on the left. When I palpated his right lower abdomen, I could literally feel his appendix. It was so swollen. He had the rebound tenderness, and that's why I took him. He didn't have much of a fever. I don't think he had a fever, and he didn't really appear that ill. My wife was surprised when I told her I was going to have to take Ben to the hospital. But when you see this sign right here, if you have that sign, that's something that ought to really throw you into action. Okay? All right, so lessons that we learned from our experience. The first lesson is that if your kids are healthy, you have much to be thankful for. As I sat in that hospital for about a week with my sick son, I could not wait to get home and have a boring day with healthy children. That was something I was taking for granted before this experience. So thank God when your kids are healthy, and enjoy your kids when they're healthy, because when they're not, it stinks. All right, so here's the big one. When you're in the hospital for anything, you got to ask a lot of questions. Now, because of my training, I knew a lot, and so I was able to, I asked a lot of questions to get Ben's care better than it was, and to get things changed quicker than they were thinking of changing it. And he would have been in the hospital longer if I wasn't asking the questions. But what do you do if you don't know anything? You don't know anything about blood tests, you don't know anything about diagnostic tests, you don't know anything about what food he should be eating, or what things they should be doing. You're just there hoping that they'll tell you what to do. Well, I did this, and this is what I would encourage you. If you know doctors or nurses, you have anybody who knows somebody that knows doctors or nurses or people that would know about this, you need to get those networks going and ask questions of them, that they will help you ask questions to your doctor, your nurses there. They are busy people, and the squeaky wheel gets the grease. And if you start asking a lot of questions, and especially when they're telling you things you don't understand it, ask them to explain it. Just ask questions, and as you ask questions, the care of your loved one will be improved greatly. All right, so that's about it. I'm probably forgetting some things, but I can't think of anything. I would love to dialogue with you about your questions, comments, experiences with appendicitis. And that's how we do that, is in the comment section here below. Just put in a comment, and there's a box there that says email me if someone responds. If you click that, you'll be notified when I respond to you, or if somebody else in the great wide world of the internet sees your comment and wants to talk to you about it, they can interact with you. So this is a real good tool. I hope it helps